Braces are the most common appliances utilized in orthodontic treatment. Only after a comprehensive orthodontic examination, including diagnostic records, are braces placed. There are many varied types of brackets and wire systems utilized in orthodontics. Each has specific characteristics to achieve a predetermined treatment goal. And just as there are many different types of braces, there are just as many varied philosophies or techniques practiced. Typically, the first step in the application of braces is the placement of molar bands, when and if it is determined that bands are indeed necessary. Molar bands require a space between the molars to allow the bands to be applied. If there is not enough space available, the space is created with spacers, which are small, flexible rings resembling small rubber bands. These spacers are placed between the molars to gently move the teeth to create the space necessary to slip the band over the tooth. This may take a few days to achieve. Once the proper space is achieved, the molar bands are fitted for size and seated into position. Cheek expanders and a tongue suppression device are placed in the mouth to create the space necessary to manage and place the remaining appliances. Next, the teeth are then thoroughly cleaned to remove any plaque or debris to help assure secure bonding. Once cleaned, you will be asked to thoroughly rinse your mouth. An etching material is then applied to the surface of each tooth. This prepares the surface of your teeth for the bonding agent that will hold the braces in position during treatment. A primer or sealer is then applied similarly to the etching material. This primer will react with a composite or bonding agent, which is then applied to activate the adhesives. Brackets are placed tooth by tooth in exacting position. Each can be measured to assure proper positioning. In most cases, the slot of the bracket is measured from the bottom edge of the tooth on each tooth. Next, a high-powered but safe curing light is utilized to activate and harden the adhesive to secure the bracket to the teeth. Some bracket types are pre-coated with the bonding agent already in place. Lastly, an arch wire is placed in the brackets and secured. Today's arch wires are made of special metal material that creates force to move the brackets as the wire tries to achieve a perfect arch. Your braces will go to work immediately. Be sure to follow all of the guidelines and instructions for care of your new braces, as patient compliance is a critical component to a successful outcome.